Two tumors, same origin, completely different behavior. One quietly wraps around vessels, the other invades and spreads. Can imaging really tell the difference? Let's break it down. Hi everyone, welcome back. Today we are simplifying an important radiology topic. Ganglioneuroma versus ganglioneuroblastoma. Imaging differences you must know. This is high yield for exams and real clinical practice. Both tumors arise from neural crest cells of the sympathetic chain. They are part of a spectrum. Neuroblastoma, the most aggressive. Ganglioneuroblastoma intermediate and ganglioneuroma, the benign, fully mature form. You'll most commonly find these tumors in the posterior mediastinum, the retroperitoneum, especially adrenal region, and less commonly in the neck. Let's start with ganglioneuroma, the benign one. On CT, it appears as a well-defined, homogeneous mass. Often shows low attenuation. You may see fine, punctate calcifications. Enhancement is usually mild and delayed. On MRI, T1, low signal. T2, very bright signal due to myxoid stroma. Progressive, delayed enhancement. Now here's the key clinical pearl, it can encase vessels without invading them. No necrosis, no hemorrhage. This behavior is very important. Now let's move to ganglioneuroblastoma. Which is more aggressive? On CT, it is heterogeneous. Contains necrosis and hemorrhage. Shows coarse, irregular calcifications. Enhancement is more pronounced. On MRI, mixed signal intensity. Areas of hemorrhage. Irregular enhancement pattern. And most importantly, it tends to be invasive, may involve adjacent structures, can show lymph nodes or metastases. Let's summarize the key differences. Ganglioneuroma. Well-defined. Homogeneous. No necrosis. Fine calcifications. Encasement without invasion. Ganglioneuroblastoma. Ill-defined. Heterogeneous. Necrosis present. Coarse calcifications. Invasive behavior. In this smart art we can mention the most important and common tumors arising from posterior mediastinum, which are schwannoma, neurofibroma, ganglioneuroma, ganglioneuroblastoma, neuroblastoma, paraganglioma, and pheochromocytoma. Here's how to think in exams and practice. If there are bright T2 plus delayed enhancement, plus vessel encasement without invasion, this pattern suggestive of ganglioneuroma. While if there are heterogeneous mass plus necrosis plus aggressive features, invading near vessels, this pattern is suggestive of ganglioneuroblastoma. In real life, if you see a posterior mediastinal mass wrapping around the aorta without narrowing it, don't panic. Think ganglioneuroma, not malignancy. If this helped you simplify the topic, don't forget to like and subscribe for more radiology made easy. Let me know in the comments what topic you want next.